Hello, this is Dr. John Wallman. Welcome to another in the series of the Reasons for Calm COVID-19 series. This episode is on confirmed mortality rate, same as the flu. Two new research studies show. First, let's start with mortality rate and why this is the most important number. What the mortality rate is the number of deaths divided by the number of people infected. And let's look at why this is important. Because first off, the number of people who get infected is almost irrelevant. If there's no significant consequences to getting infected, then so what if 1% of the population gets infected or 100% of the population gets infected? So for example, does it matter if everybody in the country gets green spots on their faces for a week and then everything goes back to normal? Nobody gets hurt, no permanent consequences? No. It's even not as important tallying up how many people die, because you have to look at how many people per population. So if we're looking at a huge population, then when you get up to that large of a population and your numbers are comparable to a dozen other reasons why people are dying, then it's like, okay, well, yeah, it'd be good to deal with this, but it certainly doesn't warrant bringing the country to a halt. Otherwise, you'd have to do it for a dozen other reasons. So for example, car accidents. In the United States alone, this accounts for 30,000 to 40,000 deaths per year. Do we shut down the highways until we can reduce that to zero? No. The annual flu mortality rate in the US is somewhere in the ballpark of 33,000 to 60,000 deaths per year. And this looks like where we're going to end up with the COVID-19. Just to put it into context with one more example, aspirin deaths, or NSAIDs more specifically. In the United States alone, people who die from NSAIDs, which includes aspirin, just with the diagnosis of arthritis, results in 22,000 deaths per year. There's no clamor to pull aspirin off the market or NSAIDs off the market until we can get that down to zero. So the number of deaths is not that important unless we're going to apply that same standard everywhere. But the mortality rate is significant, and this gives you an idea of how significant the consequences are of an infection. And if the mortality rate is high, it warrants using an all-hands-on-deck approach. Then everybody needs to be protected. If 50% of the population can get infected from something, and of those who get infected, 50% are going to die, that's a lot of deaths, and that warrants everybody doing everything they can to contain it. But that's not what we're looking at here. So let's look at what happens in a new infection. And this is a classical progression of what happens, and this has happened for every one of the major disease outbreaks over the past 20 or 30 years. It starts out that the mortality rate in the initial phase of a new outbreak of an infectious disease is extremely highly overestimated. And this happens because you know the deaths very accurately, the numerator of the equation. You have the bodies that die. But the number of infected people is very low because there aren't tests available widely. You don't know what the disease is. You have to make new tests for this. This takes time. So you get an unknown disease killing people, and you have to develop tests. But until then, all you know is you've got dead bodies and very few people getting tested. So a very, very high mortality rate. Then in the early pandemic phase, now we kind of know what the disease is. We have some tests that are getting developed. More people are getting tested. At least everyone who's showing up at the hospital gets tested. And then the death rate is still accurate as it was in the beginning phase. So now it's still overestimated because we don't know about the rest of the population. We just know about the people who are showing up at the hospitals. So we don't know about the people who are showing up at doctor's office with kind of some mild symptoms, or people who don't even go to the hospital. How many of them got infected and didn't even know about it? We don't have those numbers yet. In the early pandemic phase, which is what we're leaving now, what we were in over the April and the first part of May, in March and the first part of April, was the early pandemic phase as the numbers were going up. And the numbers of mortality rate were moderately overestimated. Then you get to the declining pandemic phase, or the last phase, which is what we're entering now in the middle of April. And at this point, the accuracy rate should be starting to approach accurate as more tests are available, and now we can start measuring people who are out in the public who aren't showing up at doctors' offices or hospitals. But at this point, this is where the vested interests start padding the death rate to try and make it look more severe than it is. And you can see this happening by changing the way of measuring deaths, where in the first part of the disease, when they're trying to get a handle on it, you're looking at only confirmed deaths. Everyone who dies gets a test done, and they find out why they died. Did they have COVID or something else? And now they're changing it to, well, it's either confirmed COVID or COVID-like illnesses. That's one of the ways they start padding the death rate to try and make this look worse than it is. And then we'll get into at another point why somebody would want to make this look worse than it is. Then we have the end of the pandemic phase, which we're just starting to get into now. And this is where you start getting accurate death rates. Because now what we're having done in the first couple that have come out, these are scientific studies which are using proper sampling and statistical methods. They're measuring just the right number of people to give you an accurate analysis across the population. And we have the first two that we're going to report on today. But we have to take caution because there are going to be vested interests that continue to try and inflate the mortality rate by all sorts of tricks in the trade. And there are certain groups that are particularly famous for this. They're going to do things like combining deaths. So if somebody is hit by a car and they also at the same time have COVID-19, the instructions are right now to say they died from COVID-19 and not from the automobile accident. There's a number of situations very similar to that where now they're combining categories of death from unrelated causes and put on the death certificate instead COVID-19. So these two studies, let's get into them now. Now that we know the mortality rate is the most important number to look at. So these are the first two studies that were broadly done scientifically. It's not relying on, for example, the numbers just from one cruise ship, which we've had those numbers for weeks now. And they were kind of pointing in this direction, but the population was not statistically relevant to the population as a whole because cruise line passengers tended to be a very select slice of the population. They not only tended to be wealthier and healthier, but they tended also to be older. So these two new studies that came out were looking at trying to measure how many people had gotten infected. And what they found was that the number of people who were infected and showing no symptoms was much, much higher than anticipated. Now, these are just the first two studies, and there's many more studies coming. So this should be looked at as giving us a more accurate, and we'll get even more and more accuracy as we go on if we pay attention and don't let the vested interests inflate the numbers. Okay, so if we look at this quote for a start, this is from Dr. Fauci in the New England Journal of Medicine from 3/26, so just about 3 weeks ago. Quote, if one assumes that the number of asymptomatic or minimally symptomatic cases is several times as high as the number of reported cases. The case fatality rate may be considerably less than 1%. This suggests that the overall clinical consequences of COVID-19 may ultimately be more akin to those of a severe seasonal influenza, which has a case fatality rate of approximately 0.1%, end quote. Okay, now this is significant because we have to remember that in the very first week, the fatality rate was reported to be around 10%, and then that dropped down to 3 to 4%. And then over the past few weeks, the models that some people were looking at dropped that now closer to 1%. And now once we're getting some real data in, it's looking like it's going to be more like 0.1%. This Santa Clara study, in particular that we're going to report on first, was completed and reported on 4/17, so just a day ago. And what they found was more than 50-fold increase in coronavirus infections compared to the officially reported cases. Okay, now let that sink in for a moment. 50 times more people infected than officially reported. Now, where was this reported? This is in Nature journal, one of the most prestigious journals in the world. The study was done in Santa Clara, California. They found 50 times more people infected than the official estimates. The vast majority of these people infected had no symptoms. No symptoms. For this study, the mortality rate in Santa Clara was determined to be 0.14%. The annual flu mortality rate for the United States ranges from 0.1% to 0.15%. So this puts the COVID-19 mortality rate squarely in the range of the annual flu. So one quote from this study was, antibody tests suggest that coronavirus infections vastly exceed official counts. One of the other studies that was done just recently was from University of Bonn. Okay, and this study came out, the results were reported on April 9. They looked at 1,000 people in the Gang-Gelt in Heisenberg district of Germany, North Rhine region. The official estimate of people infected in Germany is 0.15% of those people infected of the whole country. So this antibody study confirmed that 15% had been infected and had antibodies to COVID-19. This result was reporting that the number of people infected is 100 times higher than the officially reported numbers. And again, the higher the numbers are of people infected, the lower the mortality rate is. And most of these people getting infected have no symptoms at all. Okay, so what does this mean? The mortality rate is now getting confirmed, and we'll be looking at more studies to make this number even harder and more firm and reliable. But the mortality rate now is being confirmed to be the same as the flu. The vast majority of people who get infected show no symptoms. This also then implies that protective measures, such as social distancing and vaccinations, where you are treating the entire population, is an unfocused strategy and minimally productive. Why are you treating the entire country? To help a very small percentage of them. Resources and containment efforts are being wasted on people who do not need it. Instead, this points to the aspect that targeting efforts on the high risk and very high risk population is going to be much more productive and much more cost effective. And you can do that in a number of ways. In prevention, There are a number of very well-documented ways that you can improve the immune system function in fighting off infections. 2, you can focus on treatments of just the people who are getting sick with the antiviral medications, many of which are under study, and some of them are showing some very promising results. And 3, as a last resort, shielding and quarantining the very high-risk people anytime there is an outbreak, rather than quarantining the entire population or doing social distancing for the entire population. Just quarantine the very high-risk people. Bottom line, if you don't worry about the annual flu, don't worry about COVID-19. So, one of the things to think about on this, and this should be known and has been known in medical circles for decades, that this is what happens with infections, and this is being hyped totally out of proportion. So you have to ask yourself, is this a medical crisis, or is this a self-induced social or political crisis? Thank you.